Let me tell you why. You could not pay me to take metformin ever again.
Okay, I'm sad. Let's
So
listen.
when I was on metformin, I was pooping. I was pooping all the time. I was pooping whether I wanted to or not. I was pooping in places where I didn't want to poop. I was pooping in places where I needed to poop. I was pooping in places I had to poop. Poop was me and I was poop, and poop was who I became. And it was just so much poop everywhere that I could not like stomach the thought of like how bad the urge to poop was. And every time I thought about a toilet, I like started to wince, and it felt like PTSD.
Hey, my name's Ethan. I'm a pharmacist and also a certified diabetes outpatient educator. And I used to prescribe metformin all the time when I used to work in my diabetes clinic. I'm going to give you some tips to make sure that when you're on metformin that you're not needing to poop 24/7. First off, why does metformin make you poop? Metformin works in your liver to reduce sugar production, but it also acts on your gut. So it pulls extra water into the stool, changes how bile acids move through your digestive tract, and can even shift the balance of your gut bacteria, which all of these changes can speed up things in your intestines, thus making you go to the bathroom. Here's an analogy I like to use. Think of your gut like a sponge that normally absorbs water slowly. When you take metformin, it's like squeezing that sponge and letting the water flow faster. More water in your intestines means like looser, quicker stool, which is why you might feel like you are always needing to go to the toilet. But I will say for many people, it does get better over time. So some tips I recommend are making sure that you're taking it with food. I always recommend starting on the lowest dose. So when I was prescribing, I would always do 500 milligrams once a day. But personally, what I would do just to, avoid any of those issues is I would try to prescribe the metformin, the extended release of the 500 milligrams, and hopefully the insurance would cover it because there is less stress on your GI and less of those GI symptoms. But of course, if after all those changes don't do anything, then talk to your doctor about switching to a different medication because there are so many options for you.